Minister of Health and Social Welfare, Professor Ali Pate, has highlighted need for increased health funding in the country. Speaking before House Committee on AIDS, Tuberculosis and Malaria in Abuja, he emphasized that healthcare is a shared responsibility of the federal, state and local government.
If you look at the spending on health in Nigeria, we're not spending enough for the population, and there are many comparators. But for every, let's say, 1,000 naira that we spend, total health expenditure, about 100 naira will come from external parties, about 300 naira will come from all levels of government, and 60 naira is coming from private sources, households, and out of pocket. So the external component of our total health spend is less than 10%, is 10% or less of the total spending on health.
Committee Chairman Honorable Amoli Ogha emphasized the need for increased domestic health funding as well as reduced reliance on foreign aid. He noted that while the United States government has withdrawn financial support for African health systems, Nigeria has responded by allocating more resources to combat diseases like HIV, tuberculosis, and malaria, turning the situation into potential advantage.
As we are all aware of the withdrawal of financial support by the U.S. government funding for African health system, the Nigerian government has equally risen to the occasion by allocating more resources to the fight against communicable diseases such as HIV, tuberculosis, malaria, immunization, and so on and so forth.
Despite the abrupt nature of it, I think Nigerians can be rest assured that government is doing all that it can within its limited resources to ensure that we provide for the treatment of our population this year and also in the years to come. In terms of buying the commodities, bringing them in and distributing them. It may not be the same level as those who were bringing it through the external parties who were doing it. They were bringing those resources from paying in US dollars. We have Naira.